The Integrated Mental Health Services program is comprised of 4 clinicians and 1 team leader, and they provide services to children in care of the ministry. And they work in collaboration with social workers, with community, with schools, around the care and treatment plans for children in care.
The goal of the Integrated Mental Health Services team is to support kids beyond the scope of traditional mental health and into actually thriving. And so we focus a lot of the time on the significant others around the child or youth. So that's their caregivers, that's their teachers, and teach them how to understand and take optimal care of the children. And in doing so, they flourish.
Integrated mental health clinicians are a little bit different than mainstream mental health clinicians because they spend a lot of time providing consultation and support to care teams. And anybody who is involved and touches that child's life, they bring to the table and really try to create like a shared understanding of that child or youth to really sort of shift how we approach working with those kids in order to help them sort of reach their full potential.
In 2007, what I saw was a lack of clinical services provided to our children in care. What I envisioned at that time was to create a mental health team that would provide in-depth services to those children.
The program is bridging different services by bringing people out of their silos and around the table. So instead of a social worker coming up with a plan, a clinician coming up with a plan, instead everybody's coming up with one plan. And that is sort of how we're benefiting our kids in care.
I'm super proud of these women that do this job day in and day out, because what they give us actually is a huge amount of insight into the experience that our kids have had. We have successes in that we see kids that have experienced fairly substantial damage early on in their lives achieve incredible outcomes.